So our group special population is ovarian cancer in low socioeconomic areas, and our names are Liliana, Alexander, and Adley, myself. So starting things off on a sad but important note, this past summer, one of my first college class friends passed away from a rare form of ovarian cancer. I personally thought ovarian cancer was something that only occurred in older populations and it would never happen to anyone in my life until it did. The cancer came quickly and suddenly, and if my friend and others in her close circle knew some of the signs and symptoms, maybe it could have been caught earlier and she would have had a better prognosis. Like said in this source, normally the survival rate is over 45% for women under the age of 50. So it was shocking when she passed away from it. So, just some background about ovarian cancer and how serious it is. It actually has the worst prognosis rate and the highest mortality rate, specifically in African American population. So, because of this alarming statistic, we decided to research the prevalence of ovarian cancer in rural, low socioeconomic areas. So, when conducting research for my portion of the presentation, I found that shockingly, there are huge disparities in genetic testing. Specifically, the lowest referral rates are for Black patients, and patients with private insurance were more likely to be referred to genetic counseling as opposed to those with Medicare or Medicaid. After spending this entire semester learning about Medicare and Medicaid, when I read this research article, it really stuck out to me as I was confused how the difference between public and private insurance could lead to lack of a referral, thus lack of a better prognosis for different patients. While researching some common ovarian cancer prevention methods, I found were oral contraceptives, tubal ligation, which is getting your tubes tied, or hysterectomy, genetic screening, and importantly, education about symptoms. So some of the pathways and overlap I kind of found in some of my research for addressing solutions were advancing individually tailored interventions for patients, peer-based approaches, and addressing policy changes regarding screening and diagnosis of ovarian cancer in these specific areas. Despite some of the alarming statistics we previously shared, there is a lot of hope for the future regarding ovarian cancer treatment. There is targeted therapy, secondary surgery, and PARP inhibitors, which is poly-ADP ribose polymerase, and these are some of the newest treatments that have been discovered.
Hello, my name is Alex, and I'll be discussing some recent trends, risk factors, and how some populations are more at risk for getting ovarian cancer. So to start, some recent trends are that the CDC has estimated 19.6 thousand new cases of ovarian cancer in 2024. Next, they also estimate 12.7 thousand deaths due to ovarian cancer. And this will represent 1% of all new cancer cases in the United States and 2.1% of all cancer deaths in the United States. Furthermore, they found that the age-adjusted rates and the age-adjusted death rates have been declining since the 2010s. And this can be seen on the graph on the right. All right, now about genetics. So mutations in the BRCA genes account for 5 to 13% of all ovarian and gestational cancer cases. Some populations may have a higher risk of this mutation, such as the descendants of the Ashkenazi Jews, which is a diaspora group whose ancestors lived in Central or Eastern Europe, so countries like Germany, Poland, and Russia. Also, those who have a first-degree relative, which is a parent, a child, or a sibling, who have or had breast or ovarian cancer. And lastly, 2 secondary relatives, which is a grandparent and or uncle, niece or nephew, who have or had breast or ovarian cancer. And now I'd like to mention that individuals with low socioeconomic status, or SES, are less likely to undergo genetic counseling compared to women in high SES. And now just look at socioeconomic status by itself. Low SES is associated with reduced treatment and increased risk of mortality for those with ovarian cancer. And additionally, those with low socioeconomic status have a 15% decrease in likelihood of receiving ovarian cancer treatment compared to those with higher socioeconomic status. And lastly, race. In the United States, racial minorities are disproportionately affected by ovarian cancer, particularly African American women. So, if you look at this graph here on the right, we see that African American women have the second lowest incidence rate, but they also have the second highest mortality rate. That's a little bit weird. How come the same population can have the second lowest incidence rate but the second highest mortality rate? One reason might be that African American women are more likely to have low SES, which is correlated to a lesser likelihood to receive genetic screening, and cancer treatment. One other thing on this graph, we see that the US incidence rate and mortality rate, in most cases, is higher than the world average incidence rate and world average mortality rate. So, how come the US that has advanced medical facilities and trained doctors have higher rates compared to the rest of the world? One reason might be the disparities in access to healthcare and healthcare insurance. For instance, individuals who in low SES may not have the insurance that can pay for the cancer screening, genetic screening, and cancer treatment needed to treat and prevent ovarian cancer. Another reason might be that their managed care insurance, other doctor that's closest to them, is out of network, and they can't afford to travel to the closest doctor that is in network. Another reason is the prevalence of risk factors, such as obesity, in the case that the United States has one of the highest rates of obesity in the world. And lastly, genetic factors. The United States has a lot of immigrants, especially from Central and Eastern Europe, which may explain why the incidence rate for ovarian cancer is so high. Thank you.
Hello, my name is Liliana Gonzalez Alvarez. To continue our conversation about ovarian cancer, I'm going to be discussing the barriers to early detection. One of these is a lack of screening programs. If there's limited access to pap smears or other screening tools, then people are not able to get the care that they need. This is especially common within underserved communities. Also, if individuals are unaware of the different symptoms of ovarian cancer, such as bloating or pelvic pain, among others, then they are not able to tell their doctors how they're feeling. So, how exactly can we improve access to care? One of these ways is through telemedicine and remote consultations. As we saw during COVID-19, telehealth has made healthcare more accessible, especially within underserved areas. Mobile clinics can also offer screenings and care in general to these communities. And community health workers play a huge role in early detection and education and just providing support to these patients. As we've discussed in class, the role of primary care providers is crucial, especially when it comes to preventative care measures, which is why it's so important that physicians and community health workers are trained and have the awareness to identify early signs of ovarian cancer. Also, we have touched a lot on insurance, so it's important to be able to create a referral pathway so people are able to get timely and accurate diagnoses. There are several barriers to effective treatment, such as cultural and social factors. If cultures have beliefs about cancer, then women are a lot less likely to seek care or even discuss their symptoms at all because it's considered a taboo topic. Also, misinformation spreads like wildfire, and if people have misconceptions about treatment such as chemotherapy, surgery, or just in general, this can cause women to not get the care that they need. Language is definitely another barrier that a lot of people face when trying to access care. If there's misunderstandings about symptoms, diagnoses, or treatment options, this can cause poor health outcomes in general, which is why it is crucial that bilingual staff and translation services are provided to patients so they're able to understand the importance of early detection for ovarian cancer. It is incredibly important that we help patients feel empowered. We can do this by implementing community-based programs that teach women in low-income areas how to recognize early signs of ovarian cancer and how and where to seek treatment. Also, encouraging women to speak up about their health, seek second opinions, and be proactive is crucial. My mother went through a health scare this past year, and if it weren't for the fact that she was a self-advocate, then she would not have gotten the care that she needed. As we wrap up our presentation on ovarian cancer awareness, we'd like to leave you with this question. How can we make ovarian cancer education more accessible and relevant to people in our local communities? If you'd like to learn more about the information we presented, on the next two slides are the sources where we found our information. Thank you so much for taking the time to learn about ovarian cancer in low socioeconomic areas. Our names are Liliana, Alexander, and Adley.